name is Jay McFarland, and I want to welcome you to another edition of Patient Preferred Presents. Today, I'm very excited to introduce our special guest. In honor of Breast Cancer Awareness Month, I want to introduce you to Dr. Elissa Santoro. Now, she has been in the medical field for an impressive 50 years. As an oncologist with a specialty in breast oncology, she's held that for 47 years. And when she first said that she wanted to be a doctor, everyone around her told her as a woman, you should be a nurse. And she plowed right through that idea. So I can't wait for you to hear about her life and her experience. We'll also speak with her about how the treatment of breast cancer has changed over the years and why is there a sudden increase in breast cancer cases. Dr. Santoro, such a pleasure having you on the broadcast today. I always like to start out by asking people if you knew early on that you wanted to practice medicine, or what did you want to be when you grew up?
Well, my little girlfriend and I, preschool, used to play doctor with our doctor's kids on our dolls. And when I got to kindergarten, they asked us what we wanted to do. And this was 1943. And so I went around the room and I came to me and what do you want to be? And I said, I want to be a doctor. So the kindergarten teacher said, stand up. And I knew, what that meant. So I stood up, happy, because I was getting started in my medical career in kindergarten,
Yeah.
And so she said, do you know that you're a girl? And I knew that answer. And I said, yes. And then she said, well, you have to be a nurse.
Oh.
This is 1943.
Right.
So I felt sorry for the teacher because I was a young child, very innocent, that she did not know what I knew.
Mm.
My family doctor, my parents, we checked with, you check with everybody. And they said, of course you can be a doctor. And I had great support from, as I said, the family doctor and my parents and my dentist, So my dentist went to school with my uncle who was a lawyer. And so they were very close. So I had like family in that era. When you went to even the dentist, you talked, relationship, family doctor in his home. And our family doctor's wife was in medical school and then the Depression hit. So only one of them could go. So she had to quit medical school in that Depression era. So she was my role model in a sense because she was extremely bright and unable to finish, but yet affirming to me that I saw a woman who was in medical school, even though the Depression has always changed people's lives. But she worked with her husband in their home, as that's the family, the old days. You went to the doctor's home, and it was a solo practitioner who did everything. The family doctor did surgery, delivered babies, took care of the sick, made home calls. So I had a lot of affirmation. So the teacher's answer to me was, you have a problem.
Wow.
Sit down. So the rest of the year, she didn't talk to me, but that was okay. Because I had affirmation, from the right sources. And I just felt that she wasn't aware of what I knew.
Well, amazing story that you were surrounded by such support, but
yes,
you were really still pioneering in a lot of ways back then.
Well, I didn't think it was pioneering, but I have a funny story about my mother and I in the kitchen. I was just about above the sink, helping do the dishes with the old method of washing and drying in the sink. And my mother said to me, it's a good thing you want to be a doctor. And I was puzzled. And I said, why? She said, because you can't take orders. I hated housework. So that was my mother's intuition into I couldn't take orders. Because as you know, doctors give orders and nurses take orders. So
So
My
that was your perfect career then.
Yeah, my mother already affirmed my problem of
Yeah.
being, strong-headed and determined, and having somehow I had the gift of not letting anybody tell me what I couldn't do. And my parents happened to be visiting me at medical school with the pathology professor. It was like that parent-teacher thing. And I'll never forget his words to my parents. Don't ever tell her she can't do anything, because she can. So I had that constant streak in me, apparent even to the professor. So then there was, what do you do after you finish medical school? So I figured I wanted to do everything, which I had to figure out what could it be that I can do everything, because my family doctor did everything, but now we have specialization. So I was one of two that got the first straight surgical internship, because I figured surgery, I can do everything. And so I had the first straight surgical internship with a partner. The two of us were women. And we were at the Women's Medical College, where I wanted to go because in the seventh grade, my librarian at the grade school, a nun, knew I wanted to be a doctor. And so she said, "There's a book I think you would like." And it was 1952. And so it was 1950 rather. It was a book called 100 Years Anniversary of Women's Medical College. And she said, "You can go there because they take women." Because you remember, about 1 or 2% of the medical schools allowed women to come, not necessarily wanting them. It was just kind of allowed. There were a few medical schools like Jefferson that would not take women. That had later on got changed by the government, that there's no bias. But in my time, so I read the book in the seventh grade, and I said, "That is where I will go." And that's where I went. And I arrived there in 1960, and thrilled. I mean, because I knew the place as though I had been there.
Wow.
So then I had a lot of friends that went to New York to train, and they kept saying, "You've got to come to New York. You've got to come to New York." And so I left the program in Philadelphia, and I went to St. Vincent's in New York City. But the chief of surgery at New York, St. Vincent's in the Greenwich Village, which is now unfortunately gone since 9/11, did not want to interview me because I was a woman. So he sent his assistant doctor, surgeon, who was married to a pediatrician woman. So he interviewed me because the chief of surgery didn't want to waste his time. So my friend and like sponsor, his name was Dr. Mitty, affirmed me, and they gave me the slot. And so I started there, and the first assignment was the emergency room in Greenwich Village, 24 hours on. I had no clue about a lot of things coming from a Catholic background because it was like I didn't understand. The nurses always were laughing because I didn't understand, a lot of things. So, but I really had a great experience because all my colleagues were male. And at that time, Johns Hopkins was doing surgery to help people transform into what they wanted. And the problem was that my male colleagues couldn't handle the changes because we had wards then, and you couldn't put this person in a female ward because the surgery wasn't completed. and you couldn't put them in the male ward because they look like women. And so I called administration. And here comes my mother again. I called administration and I said, I need a private room. Now, that era, that was before Medicare, a private room. We had clinics, wards. We had private patients, but the standard was for everybody in, wards and clinics. So administration said, we can't do that. And I said, well, we have no choice because we cannot, change what's going to be, and we can't upset the two wards. I got a private room.
Mm.
And I had a tremendous experience of learning about people. Because being a woman, it's interesting. People confide in you more.
Mm.
Because we have that motherly, non-judgmental instinct. It's just a gift, in my mind, the motherly gift. So then they opened up a Manhattan Bowery project that I worked every other night, but on other nights off, which was like 4 hours or so, the police took me to the Bowery. And on the fourth floor of the Bowery, they set up a little mini, not a hospital, but like an urgent care today. Mm. And we decided in this Manhattan project, we'd have psychologists, psychiatrists, social workers, detox, and if they needed surgery, we sent them to St. Vincent's. And they were my patients there. So the police had to bring me down and go up the elevator. And I learned again, there were judges, all kinds of professionals, had nothing to do with uneducated people because alcoholism takes a toll on whatever reason, all people's backgrounds. Mm-hmm. And so we used to laugh because we were ignorant at the AA, Alcohol Anonymous. They met there, I think, weekly. And we said, we've got psychiatrists, we've got social workers, we're going to get them jobs. And so it turned out that our recidivism, where people fail after having a job, clothes, all that support, detox, about 90% came back. Mm. AA, about 50% came back. Mm. Now, why was there a difference? AA is made up of alcoholics who have recovered. They had not sympathy, but empathy. We thought we had empathy, but we didn't understand what these people have gone through. So persons of experience who have recovered and they had a constant partner, we turned them out with nice clothes, nice job, a social worker, but that's not the same thing as talking to someone who has conquered. But each day they had to pick up the phone or the person would stop in. So AA beat us.
Yeah.
So again, you can't have sympathy. You have to have empathy. But how do you get empathy if you haven't been there? So that was a tremendous, wonderful education in St. Vincent's was in the village. So we had Chinatown, Little Italy, and people who were visiting in the village that got injured, were brought there. So we had a whole beautiful diversity. Cultures. I learned so much about culture, which we were all really protected in those days. We didn't understand other cultures because not that exposed. But in Greenwich Village, you have the visitors from everywhere. You have all the little cultures of Asian, Chinatown, Little Italy, and other cultures were there. So that was a tremendous insight.
It's just an incredible story, just hearing about how you've progressed and learned over the years, and the difference between sympathy and empathy. And I know in today's world, it really feels like we're missing that a lot from doctors. But eventually you did get a specialty, right? You did start
Well,
focusing on
first,
breast oncology.
well, when I started at St. Vincent's, the message was, you will not be able to finish your chief year here because you're a woman.
Hmm.
We'll send you to Buffalo. We have an association there where you can go and finish your chief. You have to have, 5 years. The chief year you have to have to get your boards, to get eligible. So I listened and I smiled and I thought, I'll be here because my mother was right. And the fellows had a private surgeon they did not want to scrub with because he was such a fantastic surgeon, but he didn't let them do anything, and really assist like the other surgeons. So they decided that was going to be my assignment to this gifted surgeon who doesn't let you do anything. Well, I did 90% of his cases.
Oh, really?
And then later he wanted me to join him as a partner. But I wanted to be independent still. I can't explain. I didn't want to be someone's junior partner. I wanted to be me. So then I had two fellowships. Um, the American Cancer Society training grant, which I did at St. Vincent's, where I learned about tumor board and how you have to bring all the specialties together to decide what to do with the patient. And that was novel. It was just beginning because there still was no board certified medical oncologists. There were hematologists, and there were very few drugs. And so then I had a fellowship at New York Medical College where I was teaching, and it was from the National Institute of Health. And there I was part of the Central Oncology Group on the beginning of using chemotherapy,
Mm.
which wasn't, it was all brand new. And in 1974, a marvelous thing happened. Betty Ford had breast cancer.
Mm.
She was the president's wife. We knew from our research that you should give chemotherapy after surgery and not wait till it spread. Because until that time, we were afraid to do anything but wait till it metastasized, then give something. Well, of course, logically now it doesn't seem logical, but that was the way it was. So we broke the code because we couldn't give President Ford's wife a treatment that other women wouldn't get. And that was the beginning of what they call adjuvant chemotherapy, adjuvant therapy. And that was a game changer. And in the year 1974, there was the first boards for medical oncology. And so now the hematologists were becoming medical oncologists treating solid tumors. Those of us in surgical oncology, which I was in for study, my studies, we were giving chemotherapy for solid tumors. But it evolved later, after many years, that just the medical oncologists, because it got so complex, as you know. Now we're using monoclonal antibodies, unheard of.
Yeah, I
So,
mean, it's just unbelievable. I think about it just focusing on breast cancer, how much the treatments have changed since you got started. Talk about that a little bit, the difference
yes,
between years ago and now today.
yes. Well, unfortunately, in my early era, the family doctor did the surgery. Then later, there was surgical specialty. You had to get boards, and so surgeons would help family doctors, and surgeons just took care of the patient by themselves, and they decided on treatment. But there was no adjuvant treatment, and the woman would go to a doctor, and then I witnessed. We used to make when I was in medical school. We used to go to practices to learn about how you take care of a patient in a practice. It was rotation, which was great. But they would uh, treat the patient this way who had breast cancer. They'd look at the husband and they would say, if this was my wife, this is what I would do. She sat there like a puppy in a vet
Mm,
office. And she was in shock because those days, it was a death sentence.
right.
Why? There were no mammograms. There was no diagnostic testing. And the woman came in late. And then, depending on the cultures, some cultures see the breast as the symbol of their womanhood, and that they might lose their husband or boyfriend, whatever, and they couldn't do that, so they went into denial because it's a
Hmm.
psychiatric method to protect yourself from this fear, and so they came late. And when the mammogram got pushed by Betty Ford, she started the Betty Ford Foundation. I think you remember that. Now
Yeah.
she had three things that she did for the American people, especially women. She had a prescription drug addiction, which we know about now, because they were giving her pills for her bad neck. She had the breast cancer. All right, so we knew about having special adjuvant treatment now because of her. And mammograms were just coming into play. They were very rudimentary, but that's okay. They got started. It was called the zero mammogram. And the blue powder from the Xerox technique was in your hands when you picked up these films. But it was rudimentary, but it was something.
Hmm.
And then she had another addiction. Now, breast cancer is not an addiction, but I mean her alcoholism, she would not admit, and they had to have a family intervention. So the Betty Ford Foundation did three wonderful things: address breast cancer needing mammograms and self-examination, drug addiction through prescriptions, and then alcoholism, which women can hide more than men, because in those
Right.
days women were at home and they could be drinking at home where men had to work. It might be picked up earlier. So that wonderful foundation, 1974, Medical Oncology Boards, 1974, mammograms just getting started, 1974. So that was my fourth year of practice when all this was happening. And I was a member of the American Cancer Society in North Jersey. Um, and I was working with the Reach to Recovery, where a woman who had breast cancer would visit in those days. Actually, when I was in New York at St. Vincent's, a woman would visit who had breast cancer, visit the cancer patient, because that woman stayed in the hospital those days for about a week to 10 days. It was called Reach to Recovery. Very positive. And a woman having breast cancer visiting those who just got diagnosed and showing that she could have a normal life. Because it's post traumatic shock syndrome, really. And it's a war. Cancer, why they always called cancer a war, was the enemy. It was kind of a man's term, war. But that's what it was called, because 98% of the doctors were men. And naturally, you would use more of a battlefield approach thinking. But Betty Ford did a wonderful job, and I think she did more for breast cancer by herself doing this than history will ever realize.
Yeah, it's an amazing story. I had absolutely no idea before I brought you on. I was just looking at some of the statistics about breast cancer, and still 1 in 8 women in the United
By
States
the
in their
age of
lifetime.
85. Yeah, by
Yeah.
the age of 85. And after 70, it really increases.
Yeah.
Uh,
Do you have any thoughts on these rates
yes.
or the causes?
Yeah. Well, there are multiple factors. You
Hmm.
have to look at the woman's whole history. If a woman gets her menstrual cycle early, under 12, her hormones start early. If she has her menopause late. That's long estrogen stimulation of the breast. If the woman doesn't have a child, the breasts are not uh, functioning naturally because there's no hormone stimulation for pregnancy. If a woman breastfeeds, she lowers her estrogen count and increases a count of something called prolactin, which is protective. So this is why the emphasis, of women without children and not, or if they have a child and they don't breastfeed, that's another risk factor.
Mm.
So we look for how, and then if a woman has your child late after 30, now, what's going on in today's society? 35, 38, 39, 40.
Yeah.
When I was in high school in 1956, when I graduated, half of my class of women got married. When I finished college in 1960, most of that class got married. I'm talking about women, of course.
Mm-hmm.
So now we're having late pregnancy, not breastfeeding. Remember, doctors thought that bottled milk would be better than mother's milk, and yet mother's milk has the immune system in it. Plus, the mother gets a hormone from breastfeeding called oxytocin, which gives her a tremendous, wonderful feeling and keeps her attached to her infant. I
Mm.
mean, um, it's just amazing, all these factors that we learned later about. So the doctors were wrong. We can't make mother's milk. And now, granted, there are some poor women that can't breastfeed for
Right.
whatever, but I'm just talking about choice. I mean, they were pushing women not to breastfeed. That was probably maybe after the World War II, something like that. I'm not too sure, but they started thinking they could do better living through chemistry,
Yeah.
instead of through what God intended. So that's another factor. Now we are looking at the American society, and I saw a cartoon. You know how they're talking about how the ocean is rising? Okay, the cartoon showed a picture in the 40s, and all these people were in the water, and the low level water. And then they showed now the people in the water, but the water was rising.
Mm-hmm.
What was the difference in the picture? After World War II, nobody was obese, it was rare. Now you go to the beach, it's common to see obese people. In fact,
Mm-hmm.
we are in trouble in this country from obesity. Insulin resistance. Diabetics get 28% more cancers of any
Mm.
kind because the white fat, which makes the obesity and goes around the organs, is estrogen stimulating.
Mm.
And now, leading to obesity, processed foods that we never had before. The soil doesn't have nutrients in it, just like Roundup. And then what about the water? The water is contaminated with pesticides, not even knowing it. So our whole society went to processed foods, snacks that we never had. We had apples, bananas, but out of soil that had nutrients. Now our soil doesn't. When we ate a chicken, I remember going to the chicken place. The chickens were running around. You point to the chicken, remember? And then, I don't know if you remember, but then they would take care of the little chicken in the back. And then you brought home a feathered creature. Then you had to take the feathers out. And then you singed, we used to say on the stove, the plucked feathered chicken, which was when you ate it, it was thin, little thing, and it walked through the soup, and then you had it for cacciatore if you were Italian. But now the chicken looks like turkey, filled with hormones, and antibiotics because the chickens are kept crowded in cages, just like the animals are. And then to make a cow have more milk, they give them drugs, and that's made the cows different and the milk different.
It's
So
just a perfect storm
yes,
of events increasing cancer rates. And then you have
yeah,
genetic testing is leading women to actually make choices about breast cancer before they even have signs of breast cancer, correct?
yes. Well, in 1996, a woman doctor, Dr. King, discovered the first BRCA1 gene. Then after that was the BRCA2 gene. So a woman with that gene has 56 to 85% chance of having cancer. And this has led to women who have this gene, either one, to lower their risk by, because surgery is so advanced, having what we call prophylactic mastectomy. And if she has a family history of ovarian cancer with it, it's called hereditary breast ovarian syndrome, then we would remove the ovaries, and they can still freeze their eggs if they're young. But even if a woman did have breast cancer, she's young, she can still have babies.
Mm.
That's disproven that they couldn't. But there's all these options. And then plastic surgery has so far advanced that you can take the natural skin and fat of the abdomen, not the muscle, and transplant that up and create
Mm.
breasts with not a foreign body like an implant. And the patient has her own tissue because now we can do skin sparing and nipple areolar sparing surgery because we're picking things up, we're prophylactic. So we don't have the horror of the large tumors. Now, years ago, before mammograms and early detection, there was the radical mastectomy. Then they even made it a super radical mastectomy. The women all had swollen arms called lymphedema.
Mm.
They had their ribs showing because just thin skin. And they used the prosthesis. And naturally, it affected their whole quality of life. Whether single or married didn't matter. And it was tremendous post traumatic shock syndrome. And they didn't live long those days because we didn't have the adjuvant therapy. Now we give, if their tumors now are tested, and if they have hormone positive, and we do something called an oncotype, and if that's low, we can just give them an anti-hormone pill, such as tamoxifen or an aromatase inhibitor, depending on their age, and they can avoid chemotherapy. And now we found another marker called HER2 new oncogene, and now we have drugs just for that are monoclonal antibodies. And this all works to increase the cure rate because we know these things. And precision medicine is coming along where the pathologists can look at the tumors and they all have different properties. And genetic testing has come so far, we look at 23 genes. And we're learning more each day because it's an array. Like there's something called the Lynch syndrome by Dr. Lynch, and he found hereditary cancers like pancreas, colon, prostate, breast, things like that. So now you can identify the family and help the family tree for earlier diagnosis. Now, if a woman has a mother or two first degree relatives, like a sister or a daughter with breast cancer, instead of waiting until she's 40 to get a mammogram, she should get it 10 years earlier, besides gene testing, get 10 years earlier than the mother to consider getting mammograms, ultrasounds, because right now at 40 is the usual without all the history. And now with the gene testing and with the fact that the Ashkenazi Jewish population, by definition, has a 10% increase rate of breast cancer. And so history taking is really critical. And now you have ancestry. You can find out, you don't even know you may have these genes.
Yeah,
And
if somebody,
is
I'm sorry, go
tremendous.
ahead.
But the genetic testing now we're finding subtypes of subtypes. Yeah, so it's just, we're still at the beginning.
Yeah, I'm curious if a woman has just been diagnosed with the BRCA gene or with breast cancer, what are some step-by-step guidelines you would give them?
Well, it's wonderful because if they were to get a mammogram pickup or an MRI pickup or an ultrasound pickup, there's three modalities, especially in the dense breasts of the young. The ultrasound helps and the MRI helps. If they get picked up, it can be 2 millimeters of cancer.
Wow.
So back in the late 70s, Dr. Veronese from Italy did an experiment. Now, in Italy, they made him do a radical mastectomy for these small cancers. And then he did a lumpectomy, or conservative surgery, just took out the tumor, normal margin, and sampled. Well, they did those days, they did all the lymph nodes at that time. And then they would radiate the breast. It's called conservative surgery, and the slang word is lumpectomy. You hear that. Because it was anything too similar, and they had the same survival. And now we have the adjuvant therapy. So we've gone from the more tools we have, and if women, 2/3 of women would just get the mammogram, and if they have dense breasts, they get an ultrasound, or if high risk, they get an MRI interval, we would pick up cancers at stage 0.
Wow.
Not even needing therapy.
Yeah, that's amazing. It's interesting though, just talking to you, you've got all these societal changes that are increasing the risk of cancer, but we've also got these great discoveries that are increasing the treatment and helping people. If we could maybe shift those scales a little bit, the risk factors and the survival rates, it seems to me, would go way up.
Well, it's dramatic. It's dramatic. 2/3 of the women would be fine. Now, unfortunately, we all know COVID came. People stopped going for screening.
Yeah.
And everything, colonoscopies, prostate checks, mammograms, ultrasound, all that. And the breast cancer rate, the people going for screening dropped about 57% for 2 years because of the restrictions and not understanding what to do. So we got set back very badly in all realms. Now, many women now are in the military. Those that were in Iraq were exposed to those pits.
Yes.
Where they would burn. Also, we've lived through 9/11, and people who were helping out after that terrible, right then, that day, for days, men and women were working to help, and they were exposed. And remember those pictures of them coming out covered? Well, it didn't have to be that. Even after they were working and working and working and exposed. And now the cancer rate in these people is higher than those of people that died in 9/11.
Wow. Wow, that's
and then,
amazing.
Of course, remember way back, asbestos and mesothelioma. And now we found out about water, Camp Lejeune. I mean, so our environment has a lot to do, and we've gotten away from being balanced. So better living through chemistry was that old saying. I remember, I think it was Ronald Reagan used to do that advertisement for GE or something, better living through chemistry. I forget, something like that.
Oh, I don't
But
remember, but I
yeah,
do know.
yeah.
Yeah, I do know that awareness is everything. And that's why the fact that Preferred Health Magazine is featuring you for Breast Cancer Awareness Month, I think that that's so important that you help spread that word. Talk about the fact that you're being featured. How do you feel about that?
Of course, I'm honored, but when they called me, I said, but practicing 53 years, and because I'll be 85 next month, and the reason why I have a funny story, I retired a couple of years ago for 6 weeks. So I called one of my original trainees in Montclair, and she said, sure, come on over. So I've been working part time, seeing patients and giving second opinions and things like that. Now, another huge breakthrough is that all these specialties with the tumor board, you have the surgical oncologist, the medical oncologist, the radiation oncologist, the pathologist, the social worker, the genetic counselor, you see, as a team. So each
Yeah.
case, a real breast center has to have all these people, and the person has to be diagnosed quickly and has to be treated with input from all the specialties that they are getting the latest and the best for their individual case. That was not when I was a child.
Right.
And in fact, I think not until the 70s did they start realizing that we needed all these specialties that started to evolve. Like medical oncology became as board certified, and then radiation oncology had made a lot of progress in the change from cobalt to the new type of radiation. Um, so that so much progress, but if you don't go to a true breast cancer center as a woman, it's not smart. You have to, and they have to have clinical trials. Now we have learned, like Berenice did, that if you pick up a tumor small, which we were doing on these mammograms, lumpectomy, you don't have to remove the breast.
Mm.
Then we made more progress. We were getting such early cases. We start doing injections into the breast lymphatics, and we'd find what we call the sentinel, the guarding nodes. And if they were negative, you didn't have to do all that lymph node dissection, and lymphedema was starting to disappear. And of course, you have to have a surgical oncologist. And now our plastic surgeons have developed an ability under the microscope to connect the lymphatics if they do get a full dissection so that they don't get the lymphedema. All microscopic.
Amazing.
Also, the reconstruction, now we can take your abdominal, and those patients that qualify, they have to have enough abdominal tissue, skin, subcutaneous tissue, and it's called the deep flap because they use the microscope, get the epigastric vessels, in other words, from there, and transport that tissue up, and it's natural. So it is unbelievable. And we do now, because we're so early, not only skin sparing, we've advanced to skin, nipple, areolar sparing. Okay, so even more same image. In fact, many women say they look better, because, with age, there's something called dropsy. So but also, if a woman can't keep the nipple areola, we can make a new one, plastic surgeons. And also, we have tattoo artists that just specialize in tattooing a nipple areola that looks real.
Wow.
Yeah, so there is another earlier procedure called the tram flap using the abdominal muscle, but that weakened the abdomen.
Mm.
But that was a big advance over implants. But implants still for people that don't have enough abdominal tissue, um, have advanced so much. Now we're putting it behind the skin because they're early, rather than under the muscle. Because when it was under the muscle, if they tighten their pectoralis muscle in the chest, the implant would wrinkle.
Mm.
Now, because they're putting it just behind the skin, because it's early cases again, um, it's so natural. We didn't realize that, but we came so far. So we're picking up millimeters of cancer, not centimeters of cancer.
Wow.
But you have to have the screening. You have to have the proper breast self exam. You have to have genetic testing, knowing the family, especially first degree relative, mother, sister, daughter, first degree. Family history of other cancers, like what I said, the Lynch syndrome. So the advances have been in my lifetime. I went from no scans. Now we have a PET scan. Now they're going to use the PET scan with radiotherapy to spare tissue even more.
Wow.
That's starting up. I mean, can you believe this? A PET
Yeah.
scan of the body, so they can combine it in a special way, creating to work with radio. It's new. It's just not on every corner, but it's just starting where they can even see tissue to spare even better. So when I started, it was cobalt, which was pretty damaging.
Yeah. Well,
So
it's just been a remarkable time. I feel like we could talk about this for hours. Unfortunately, we are limited on time, but I just love your passion. I love your enthusiasm, and I love the message. I hope that everybody watches this and they share it, because as you're making the point so well, it's about awareness and early detection.
right, and the other thing now is that you have to have a whole team taking
Right.
care of the individual. So we have wonderful oncology uh, social workers. We have nurse navigators, make
Mm.
sure the patient shows up, gets their appointments, make sure they get the appointment with the chemotherapist. Not that they'll get chemotherapy, depending on their tumor, but also to get enrolled in the clinical trials. How are we going to know, like Veronese, by doing the trial?
Yeah.
And when I was in the central oncology group, learning about giving chemotherapy right away, not waiting for them to spread. So clinical trials are true hope. But the patient also needs aftercare, uh, like holistic, like the mind, body, spirit. And also they need to have inner peace. And in our society right now, we're, since COVID especially, there's antisocial. So as a result, they're increased, not talking about breast cancer, but in general, the population seeing increased suicide thinking
Hmm.
in children, teenagers, never mind adults. And then there's something called the bed rot syndrome. People are staying in their bedroom. They're even putting a refrigerator in there besides the TV. And it's called a bed rot. So where's the exercise?
Right.
We were created to move. So exercise helps in weight, uh, taking care of screening for diabetic or insulin resistance. Obesity is produces so many problems all the way around. And of course, yes, heart attack and stroke are still the leading killer of women. But breast cancer is curable if picked up early.
Yeah. Well, thank you so much for sharing your experience, for the fact that you're still treating at 85. I feel like nothing's going to slow you down. And it's just been such a pleasure to get to know you today.
Well, it's been a fun to talk about my little stories.
Well, I love them. And you're also helping a lot of people by sharing your stories. So thank you so much. Once again, I want to thank Dr. Santoro for joining us today. I just love her story and her passion and how she pushed through all of these obstacles and how she can't stop. She just continues forward. I hope that you got some great information about breast cancer awareness and the importance of getting checked and also heeding some of the other advice that she gave. Once again, my name is Jay McFarland, and this has been another edition of Patient Preferred Presents.